So the secondary victimization that I just talked about, I always like to cover this because I think sometimes people, they don't know what to say, and like sexual assault and domestic violence are very scary for people to deal with, usually because they think there's something more that they need to know, and there generally isn't, but it feels that way to professionals usually. So the things that are really hurtful that people come in and tell us they've heard a million times, whether it's at their child's school or the doctor's office, the police departments, the court, all those places, or their friends and family are really prone to doing these things. It couldn't have happened that way. Generally, abusers are very sneaky and manipulative, so they'll be very nice outside of their home and everyone will love them, so clearly he wouldn't have done it. Consider yourself lucky that you're not dead even, like, oh, you're really lucky he didn't kill you, all that. They don't feel very lucky when they're in our shelter. It doesn't feel that way. You're overreacting, and you need to put this in perspective. What happened happened. You don't need to be upset. And then maybe, well, if you had done this, it wouldn't have happened. If only you would have left sooner, even, then your kids wouldn't have been exposed to this. You should have never done whatever. That wasn't very smart of you. You must have wanted for it to happen. You must have been looking for trouble, and you need to be more careful. You must have wanted it to happen. You wouldn't think anyone would say that, but people say it all the time. Well, they must like it because they don't leave. And obviously they don't like that. So when you're responding to disclosures, your best bet is to validate the client's experience, offer discreet methods of contraception if you can. So like if you can get the partner away from her, that would be your very best, because if he's sitting right there, you're going to think she's answering, but she is not. So get her away so you can get her some emergency contraceptive if she needs it, because again, as them little clips showed, if the guy didn't say anything too much, he just kind of pokes her and says, well, tell her. And so if you can get her away to ask her if she wants emergency contraceptive, that would be best. There are quite a few cards in the back, but the safety card harm reduction strategies, and you can always give some, like those little cards, they're like the ones I brought said, how does your relationship affect your health? So it'll go through some, are you in a healthy relationship? Are you not in a healthy relationship? And they kind of like little check boxes things that so it can kind of process. Those are always good if you can't review it, if you could hand it to him, but if you can do it kind of on the down low so he doesn't see it and take it from her. Ask the client if she has immediate safety concerns and discuss options. Refer to us for safety planning. We do safety planning with anybody that walks through our door that's in domestic violence. And then follow up at the next visit, because she might have just given you this much, and if you, again, like where they might even call our hotline once, or they might come through, they come to healthcare providers or whatever service you do, usually regularly, so if you can just touch on it again, that is super wonderful. Things you can say, are you familiar with Every Woman's Place? You can call someone on the crisis line. Sometimes that's a safer option for them than walking through. We don't require they give the name of the assailant or that they do any of that if they walk through it, or their name if they walk through our door, but it still seems very scary sometimes for people. Or if their kids are in danger too, they don't want to do that because they're feeling like we might get them in trouble. Or they're afraid that we'll call the police on their assailant. We don't do that. And then there's also, you can tell them about our crisis line, and there's also national hotlines if they just don't, for whatever reason, want to be in Muskegon. So I'm going to cover our services really quick because I think I have like 5 minutes left. Get these up here. So this is for our shelter. There's 24-hour access, and if you ever need to refer somebody to us, please know if they're in a domestic violence sexual assault situation, we are full 99% of the time. Whoa, calm down. It went on its own. But we are full 99% of the time. So if we can fit them in, we do, and if we cannot, we will get them to another safe shelter. That is not ideal for people all the time, like if they have children in school, they have a job. Certainly not ideal. And we try, if there's barriers to them leaving, we do try to get them to stay with us, but obviously if your safety is at risk, we will help you get somewhere else. We also use like our local rescue mission too, if they have space and if the person wouldn't be in danger there. Our facility is very locked and there's cameras everywhere, and so if it's like a real high lethality situation, we're not gonna send them to another place. But we will make sure everybody has secure shelter if they need it. And then there's always supportive staff there, case management services and advocacy services. And as I go on, anyone that enters shelter is eligible for non-residential services too. Anybody is. So that's a picture of our room, and that's a little picture of our playroom. So the other services, we have walk-in services, 9 to 5, Monday through Friday. It's actually at our Apple location now. We have our shelter on Laketon and building on Apple. But if they come to either one, we'll try to obviously help them. Hold on, thought on its own. 24-hour crisis line is also there again. Individual and group counseling, we offer a domestic violence education support group, children witnessing group basically, and then a parenting after violence support group too. We do groups at the rescue mission and we do groups in the jail. Emergency responses, we do that for the hospitals. Both hospitals will call us if they get a domestic violence or a sexual assault in, and an advocate comes so they can sit with them while they talk to the police if they want to, or we'll advocate if somebody's assaulted. They have the hospital has to call, but the survivor does not need to speak to the police. So sometimes that's scary when people say, no, I don't want to talk to them. They don't feel comfortable doing that, so we try to help them through that. Or help them talk to them if they want to, whichever. And also we do with the sheriff's department, we will go to like the individual's house 24/7 if the assailant has been arrested. Then the dispatch calls us and we go out there, but we only do it for the sheriff's department to kind of touch the rural areas too. But if any of you at your agencies had a survivor that doesn't really feel comfortable, but you think they would let us come talk to them, please call us. We usually always have somebody available, or we do our very best to make sure we can get there. So if, Faith is over at the health department and she has a survivor that's going, I'm too nervous, I don't want to go there, I don't want to go there. But she says, well, what if somebody comes and talks to you? Please call us. We do our very best to meet somebody where they're at. Advocacy and supportive services. So we have a legal advocate at the courthouse that primarily helps with getting personal protection orders. They also go to court with people. And then really just advocacy with other systems in general. We do a lot. We do a lot with child welfare, the courts, the police departments, that kind of thing. Everything is free of charge for victims and their children. We do not do assailant work if veterans intervention is offered at Catholic Charities, and we do not do that there. Other things we do, agency presentations, dating violence presentations that you asked about, all that kind of stuff. And there's all of our info. Do you guys have any questions? Yeah?
Well, when a woman has health problems or disabilities or other things like that, can you talk about how that can be restrictive in terms of either being manipulated or, how a person who maybe, have a chronic illness is afraid that if they reach out on their own, they're going to be abandoned from a health perspective?
That's a great question, and it's really tricky actually, because if they come to our shelter again, visiting nurses can come in. We don't we don't let anybody in except for obviously if they had healthcare needs. But assailants are really good at manipulating that, and it's very frightening. If you, for instance, are on disability, it's not like you can even then go get a job and make enough money then to support yourself. You might have to really look to do all that. If you are used to living, a certain lifestyle, and then you're going to try to live on your disability check, that assailant is certainly going to use that to say you're not going to make it. And if you haven't had to try, that is going to keep you there. Or, I'm the one that takes care of you. Who is going to help you get dinner? And they don't, they either won't tell them that there's resources out there, but also it's very difficult. I mean, if you're used to the person that you live with kind of getting your, maybe your dinner, and then you have to have, maybe a Meals on Wheels program or a visiting nurse come in. When you're used to it being very familiar, they can really, really manipulate that. And coming into our shelter, like we're wheelchair accessible, but it's not ideal if you're struggling with some of those things. Mental health issues are pretty tricky sometimes too, because the guy is really good at, or the assailant I should say, is really good at using those against her to make her feel like, we have people all the time trying to commit their partner. There's nothing wrong with them. They're absolutely healthy, sane, normal, and frequently they'll try to do that. I had a elderly woman that I've probably worked with for the last 7 years, because she got services from us for about a year. Then she had to move into shelter because her family would not leave her alone, primarily the assailant, but he got the children to turn on her. But he still tries to say that her brother and sister-in-law kidnapped her. I think after 5 years after she left, the police department called me because they then filed a missing person saying they have her, she's able-bodied, clearly can make a choice, and they say that she's not well and that this brother kidnapped her. And so the Fruitport police had to call me to verify that she is on her own and doing well, because they constantly try to manipulate those situations. And she has really she did have a lot of health problems when she first came in. She's about my height, weighed about 150 pounds, but when her sister-in-law went to see her, she was down to 98 pounds, I think it was, something like that, and was basically dying from depression. Other than that, she's healthy, but they use it against her, and he uses the elderly thing to try to say she's not able to take care of herself and that these people kidnapped her. But it definitely is a very big issue, and one that they're already a vulnerable, kind of like population person type thing, and then he will play that and use it against her so that she's fearful of trying to make it on her own. What about anything else? Any other questions? All right. Okay, well, thank you guys so much, and thanks for letting us come.